Welcome back to Body Beautiful. We are talking right now with Dr. Raja Kapal about mommy makeovers. We're going to be taking your calls with any questions you have. Here's the phone number, 800-440-4884. We'll also be posting the number for the doctor's office during and at the end of the segment. And remember, any advice we give you today, you certainly want to consult your own physician as well. We actually have some before and after pictures, which really say it all. But before we actually start rolling those pictures, I mean, how do you decide whether to perform a breast augmentation, a lift, or maybe even both?
Okay. It really depends on the anatomy of the patient. If the patient comes in and her breasts look more deflated, but they've kind of maintained the shape, and what I mean is that her nipples are actually in good position, they're above the very bottom of the breast, then all she may need is an augmentation. That means only implants without anything else. But if her nipples are starting to point low or her breast tissue itself is starting to droop, then she may need a lift in addition to an augmentation. And there's a very simple test. It's called a pencil test that a woman can do at home. She can stand in front of the mirror and place a pencil underneath her breast, and if it holds, that means her breasts are too low.
We're talking about not the sharp side, people. This is just the
just a flat part, the flat part of the pencil.
Okay.
It's called, so if they fail the pencil test, then they probably need a lift.
Okay.
And if they pass the pencil test, then all they need is an augmentation. And then some women need a lift in addition to an augmentation. That depends. If they want to be fuller than what they are, then they need a lift and an augmentation. And if they're happy with their size and just want to improve their shape, then all they need is a lift.
All right. Well, there's only so much Victoria's Secrets can do, right? Let's get a look at some of the before and after shots of the mommy makeovers, just to describe what happened here. Okay. This is someone. Is that just an augmentation?
Yeah. So this woman, also a new mom, and after pregnancy, you can see that the upper pole of her chest is flatter, and her breast mostly concentrates in the bottom half of the chest, and so all she's had is a augmentation.
Okay, and nothing with the tummy? She was able to spring back?
Some of it is that, yes.
Okay, next picture.
So same thing. This woman, again, is a classic example of just an augmentation. So during her pregnancy, she actually, she had twins, nursed very well, had a lot of milk to nurse, and then afterwards she had the complete deflated breast. And so there is an augmentation after.
I guess this begs the question, would a woman be able to breastfeed after an augmentation?
It really depends on where the incision is made. If a woman wants to nurse after having her augmentation, she should have the incision placed away from the nipple area. So the other two areas would be maybe underneath the breast or through the armpit. And so this way you actually don't cut through any milk ducts, you don't cut through any breast tissue, so it really doesn't interfere with amount of milk production or the milk actually coming through.
Now, whereas if you do the lift, you might be cutting some of the
So
glands.
anytime incisions are placed in and around the nipple or the nipple is moved, you could potentially affect the amount of milk production after the surgery.
We're looking at another picture. You want to describe
this is another woman who's also had some droop of her breast, and all she's had is an augmentation.
And that's it, huh?
Yeah.
Now, did that restore her to her previous size?
She actually wanted to go a tiny bit larger, so it's a little bit more. She's got a little more upper pole fullness than she had previously.
Okay, and what about lipo and tummy tucks? And because that's also part of the, as you say, the trifecta.
Exactly.
What's the difference? So,
again, a liposuction is when a woman has subcutaneous fat deposits or fat deposits that are found right underneath the skin surface. It's considered a more superficial location, but her skin quality is good, and her muscles underneath are actually good. They haven't separated. Then all she'll need is a liposuction. Whereas if a woman really has stretched skin, has stretch marks, her skin is stretched out, is lax and loose, and then she's got what's called muscle diastasis, or that six-pack muscle is not taut and together, it kind of separates.
And no matter how many sit-ups.
And by sit-ups, you really cannot bring them together, because again, that's something that's happened during pregnancy from having the intrauterine pregnancy spreads those muscles out. So when a woman comes in that way, then it's really, we kind of really treat all those different problems with the tummy tuck. So obviously the skin is tightened, the muscles are brought together, and then usually on the sides we also do a little bit of liposuction. So there's three things done together.
Those are two vastly different types of surgery. One is a major surgery, the tummy tuck.
Yes.
You put under a general?
Yes. So really, I mean, both of them are still surgeries. It's still done under, I usually do them both under general anesthesia with an anesthesiologist. So from a recovery standpoint, though, the liposuction is a slightly faster recovery. I would say 5 days to a week. Incisions are very small, and so less so faster recovery and less bed rest, things like that. Okay. Whereas with tummy tuck, because the incision's long, it's about 2 to 2.5 weeks of overall healing time.
Well, for more information about Dr. Raja Kapal, you can call her directly, 415-392-3333, or check her out on the web at sfcosmeticsurgery.com. And when we come back on Body Beautiful, we'll continue talking about mommy makeovers, can I say this? And we'll also take your calls. We'll be right back.